Hey guys, welcome back to my channel. My name is McKenna. Today is June 12th, I think, and my 4 weeks out from surgery will be the 16th, so I'm almost there. I'm about 3.5 weeks out from my surgery. Obviously I didn't document or vlog during my recovery, but I wanted to try to capture what this recovery was like for me because it was rough, and why not document it? Maybe it'll help somebody who's had similar middle ear surgeries. I know that some of my Baja cochlear videos have reached the, hard of hearing and cholesteatoma community, if that's a thing. Apparently it is on my YouTube channel, so hopefully this video reaches some people who have surgeries that are similar to tympanomastoidectomies, mastoidectomies, osticular reconstructions, really anything that has to do with the middle ear. I'll kind of talk you through what surgery we did and why, and what the recovery was like. Also, sorry you can hear Sky chowing on a bone behind me. It's the only way to stop her from screaming, and I figured chewing sounds are better than a husky howling at you. I have had cholesteatoma since 4th grade, probably sooner, but 4th grade is when they found them. I am about to be 24 now, so that was a long time ago. I have had countless rounds of tubes, countless tympanomastoidectomies, multiple osticular reconstructions, some other mastoid something or another that I don't remember, and hold on, I don't even remember the name of this one that I just had. Okay, I went to get my paperwork, but my most recent surgery that they did was on my left ear, and it was a subtotal petrosectomy. Let me kind of explain what the surgery is, how it was different from previous ones, and why we did it. So previously, my previous surgeries, the plan was still always, of course, to remove the tumors, right? Those had to get out of my head. But there was always the overall medical plan was to try to restore my hearing naturally through osticular reconstruction, and using prosthetic inner hearing bones we tried, and all sorts of different things. There was always hope that we could do more than just remove the tumors, but we could also restore my hearing. That was always the idea. Unfortunately, that didn't work out. The tumors came back again and again and again after every surgery. Our medical plan, because of that, has obviously changed drastically. Throughout that period of time is when my hearing declined, right? And it's completely gone at this point after years and years of surgeries and removing bits and pieces of bones and eardrum, and the tumors themselves destroying things that hindered my hearing. I'm completely deaf at this point, so my hearing isn't really a factor in our medical plan. We don't really care. I'm already deaf, and I already have a bone-anchored hearing aid that I rely on to hear. It's not important to me to restore my normal hearing at all. My only goal at this point is to get the tumors out of my head and to keep them out of my head. So this surgery that they just did, they still went in behind the ear. They still removed the tumors. They removed all the infection just like they would in a tympanomastoidectomy. What was different about this one is they also closed off my ear canal. So I have stitches all the way behind my ear. Actually, that's glue. And then I have stitches on my inner ear, closing that off. I'm going to show you more pictures and stuff. But that's what was different about the surgery. They also gutted my entire inner ear. So whatever was left of inner hearing bones or my eardrum, or even they think they took the top layer of skin out of my whole ear canal, basically anything that the tumor has potential to grow on, they removed. And they closed off my ear to the outside world, so environmental factors are eliminated, aside from ones that get up through the inside, and all surfaces for the tumors to grow on are gone. So they're hoping that the surgery will keep the tumors away. I am editing this now and totally left this part out. This is only surgery number 1 of 4 in the current medical plan. So if you want to know more about my whole medical plan, let me know. But this, I'm just going to focus on the surgical story for this surgery and what my recovery was like. I need to play with her for a minute before I edit this. So I got to the surgery center, hospital, whatever it was, on May 18th. At 4:50 in the morning. Took them forever to get a IV. I was covered in bruises after surgery because they just could not find a vein, and I've never had that issue. I've had dozens of surgeries and they've almost always got it on like the first or second try. For some reason, didn't work the surgery. That was honestly the worst part of like the hospital. I do not get knocked out in the prep room. I stay conscious and they just start like IV fluids normally. Sometimes they give you a little IV meds that make you a little goofy, but like you're still fully conscious and aware. They wheel you down to the OR, you get on the operating table, they strap you in. There's this foam head thing you get put in. Your like arms are put a certain way, they're strapped over after they put monitors all over your chest and like the sides of your ribs. Yeah, they do all sorts of stuff. They put on nice heated blankets on you because the OR is freezing. And then once you're all hooked up is when they will put the, like anesthesia on you that knocks you out. They're always super goofy when they're putting you to sleep, and I'm kind of a smartass, so it works out well. But knocked out, everything was great, and then I woke up. I don't remember much of the waking up part. I honestly couldn't even tell you what room I was in for recovery, like if they brought me to a general recovery room or a private one. No idea. The few things I do remember is that my tongue was numb, just like the top half of it, the front half of it. I remember hurting. I remember like not like sharp pain, but like pressure. And then of course I have a huge bandage, as I'll put the pictures up. So I do remember that part, the being uncomfortable. And then I remember my mom telling me to breathe, because I guess I wasn't breathing well enough when I was coming out of anesthesia, and so all my alarms would like go off because I wasn't breathing. And then my mom would tell me to like breathe, you're making the alarms go off, or you know, she would try to get me to breathe, and then I would it'd be like, I wasn't fully aware, but a few times I was aware enough to be like, oh yeah, and like take a breath. So that's the only part I remember. However, my doctor informed me that I had quite a bit of facial paralysis after the surgery, which is a risk. There's a lot of major facial nerves that run in the area that they're messing with. Luckily, it all came back. I don't know, at first the paralysis was, you know, I'm sure extensive. I probably couldn't move anything. But by the time that I was conscious, the only paralysis I was having was my tongue. I could still move it. It was just, I could not feel the top half of it at all. And I did not get that feeling back for weeks. But that is not a normal thing from surgery. If you have anything like that, tell your doctor. But that was just like a weird complication that I had this time. So my mom and my boyfriend were with me, and they eventually, once I was like stable enough to leave, it did end up being outpatient because I didn't have any major complications. They loaded me into a wheelchair, we got to the car. I don't remember any of that. I remember getting in the car because the nurse helped me, I remember that. I don't remember getting dressed at all, but I did because I left in my clothes, not in a gown. I got home, and Sky, the one you've heard chowing down this whole time probably, we got home and she was in her kennel when we left. She was not in her kennel when we got home. And I guess she's stressed out because she got out of her kennel and she was like, couldn't get back in, and there was puke everywhere, and I have to walk through this living room to get to my bed. You know, that's all I was trying to do was get to my bed, but there was dog puke everywhere. She was a mess. It was a whole thing, and it was just Shane and I. So yeah, he had to clean up all that, sorry babe, and I went to bed, and then we started the recovery process.